everyone, I'm Laura Armstrong, former nurse and now full-on health and wellness junkie. Over this past year, I've been helping care for my mom, who has a massive blockage in her lower descending artery, compounded by kidney disease and type 2 diabetes. So I've taken hundreds of blood pressures over the years, and in particular, her blood pressure and including my own blood pressure. And let me tell you, I was shocked at how my own blood pressure readings changed depending upon how I sat, where I placed my arm, or even whether I had a coffee. That got me thinking, how many people are getting their readings wrong and not even knowing it? So today I'm going to walk you through how to take your blood pressure at home properly, step by step, so your doctor gets accurate information and you get better care. So let's go through the steps one by one. So step one, go to the bathroom first. A full bladder can raise your reading by as much as 15 points. Who knew? So make sure you empty your bladder when it comes to going to the doctors or taking your blood pressure at home. So step two, make sure you're sitting the right way. And posture matters a lot. So make sure you're sitting upright in a chair with back support, not on a stool or couch. Your feet are flat on the ground, not crossing your legs, and that your arm is resting on a table or cushion at heart level. And last but not least is to make sure that you keep your back straight and supported all the time. So step number three, get a blood pressure cuff that's been validated. Any brand is fine, again, as long as it's been validated. Always make sure you use an upper arm cuff and not a wrist monitor in the case of taking blood pressure. As you can tell, I've taken my long sleeve shirt off and I've got no sleeves between the cuff and my skin. Very, very important. You do not put the cuff over any clothing. You'll get an incorrect reading. Cuff goes 1 inch above the elbow. The tubing will run down along the artery. And as you can note, make sure the cuff is the right size. Certain blood pressure cuffs will show you exactly where you want it aligned, with the artery showing that it goes down the artery, and the tubing as well is going down the artery. Lastly, when you're taking your blood pressure, to make sure that if you're doing it on your own, you're not pressing the start button with the finger that has the blood pressure cuff on it. Rather, you want to press the start button with your opposite hand. So step number four, you just want to sit quietly for at least 2 to 3 minutes. Look outside, take some deep breaths, and more importantly, no talking, no distractions. Turn off the TV, the phone, and just sit quietly and relax. So step five, take the reading. You want to press the start button on your machine with the opposite hand, then the blood pressure cuff is on. Stay still, silent, and relaxed. Wait for the cuff to inflate and deflate. The top number is your systolic, the bottom number is your diastolic. You want to wait 1 to 2 minutes and take a second reading. You'll find that often the second reading is lower and more accurate just because you're more relaxed. If there is a big 5-point difference between this first and second reading, take a third reading. When you're first logging your blood pressure, try it on the opposite arm as well, because you will have differences in your blood pressure on both arms. It shouldn't be much, but you may have blood pressure variance of even 5 points on one arm versus the other. Step number 6, write your recordings in a logbook or in an app of some sort. Include the date and time, your systolic and your diastolic numbers, your pulse, and of course, which arm you used. Because it's very, very important the doctor or whoever you're going to monitor your blood pressure, it's very important that they have accurate measurements both on your right arm, your left arm, the date and time. Number 7, repeat these on a daily basis. I encourage you to take 2 readings twice a day. 2 in the morning on your right and left arm, and in the evening, same time, right and left arm. Prior to taking your blood pressure, again, very important to avoid these things: caffeine, alcohol, tobacco, and exercise. If you do see a high reading, don't panic over one number. In the case when my blood pressure was skyrocketing, again, I encourage you to watch this video on that when I found out my blood pressure was high and possibly the root cause of why I was getting a high blood pressure. It can occasionally happen, but just note it. But if you're consistently getting the 150s and 160s over 90, 95 to 100, and you have symptoms of chest pain, slurred speech, numbness, or weakness, you definitely want to call 911 and don't wait. So again, a quick summary checklist at home. Empty your bladder, sit upright, feet flat, use a proper upper arm cuff, rest arm at heart level, sit quietly for 5 minutes, take 2 readings, record your results, avoid caffeine, alcohol, smoking, exercise, all of that 30 minutes before taking your blood pressure, and repeat at the same time daily. I hope this helps you feel more confident about checking your blood pressure at home. These are simple habits that can make a huge difference in your health. If you found this information helpful, please give it a thumbs up and share it with someone you love, especially if you're managing heart or kidney issues. And I encourage you to subscribe. I have more health and wellness tips coming your way every week. Thanks for watching, and we'll see you in the next video.